Symptoms of recovery where cancer is concerned. Because I'm a cancer survivor as well. I was at fourth stage, where doctors actually told me when I should die, but I don't believe that. So basically, what supports my recovery is actually Ayurvedic. So I take Moringa, Haritaki, Ashwagandha. I believe, Doctor, you're familiar with this. How prepared or how ready is Malaysia in accepting this kind of recovery through alternative and complementary means? Because we'll be more than happy to support in terms of the international funding. Thank you.
Thank you very much, Dr. Bella. Maybe Dr. Siby, you would like to, and that also comes actually to my question in terms of the efficacy of Ayurvedic treatment. How does that actually work nowadays with the current mentality of Malaysians in general?
Yeah, thank you, Dr. Bala. See, Ayurveda system, even though it's very old system, mentioning of cancer is there, how a disease of cancer develops in the body and how it can be addressed. So there is a complete information is there about cancer, even those days. So when a patient is coming to Ayurveda, we will have to have a very thorough examination to identify what stage it is and which part of the body, whether it has already metastasized into the other parts of the body. So we need to be having a very clear picture. And suppose the patient say, Doc, do you think Ayurvedic system can manage this? Or should I go for a medical doctor and do my treatment protocol, which is chemo, radiation, or surgery, or immunotherapy? So we tell them, you need to see a medical doctor for complete investigation to identify what is the stage first, and take the opinion of the medical doctor that what is he is going to prescribe for you. Suppose we say chemotherapy is needed, or radiation is needed, or surgery is needed, we will always try to educate them. See, what I understand is that patients are informed. It's not that they don't have the knowledge about it. They are confused when they get a condition personalized. They totally lose their thinking capacity, their intelligence capacity, everything goes, they're confused. So what we do in Cancer Wire is to educate them and understand this is a stage where we advise you to do a surgery because that's the best option. But before you go for the surgery, you need to prepare the body to make sure that your body is strong. So even if you go through a surgery, your recovery will be faster. And after surgery, even if the doctor prescribe you a chemotherapy, we will we will do a complete thorough and ask the patient, how do you feel? The patient say, I do not know. My doctor said in 3 weeks I have to start with chemotherapy. So during that time, we will introduce these herbs, Haritaki or Ashwagandha. These kind of drugs are introduced to the patient to make sure that their body is strong. So we are revitalizing. The second thing is that most of the time, modern system have a very limited understanding about what food to be given to the patient or whether this food is advisable to take. Sometimes the doctors say just eat anything. Even after the surgery or chemotherapy, they say don't worry about it, you are cancer free, go and live. But after 5 years, they make it. So we in Cancer Wire, through Ayurveda and other complementary systems, what we have created a dietary plan. You tell them this food better to avoid, even if you have gone through all the treatment program, so you do not get a secondary attack. So we will have a very clear picture of what to eat, what not to eat, whether you can do a breathing technique, whether Qigong can be introduced, whether yoga can be introduced, whether meditation is good for you, if at all, when you should meditate. You can't ask the patient after surgery immediately go for an exercise. So what we plan is to prepare him, even if they are going for a surgery or chemo. Even between and after, we also provide the SLBs to make sure they lead a healthy life. So Ayurveda system give a lot of importance for preventing from cancer development. It is the same theory Cancer Wire also holds. Our education program is to educate the public not to get a cancer. If they get a cancer, of course, then any system can do whatever they can. But first and foremost is how not to get cancer. Second, once you get it, how strong you should be to face it. We make them prepare to face the cancer. Third, in case they are not in a recovery stage, they are going into a terminal stage, or like say that in a very difficult condition, then we make them understand how to lead or explore a very healthy quality life. No, they don't need to suffer too much. So then we help them how to lead a healthy, or whether it is 3 months or 6 months or 10 years, we make sure that they don't suffer much. So that is the role which we are playing in as far as cancer is concerned. Thank you for listening.